I am with Maggie Brennan, the president and the CEO at North Shore Community Health. Hi, Maggie.
Hi, good afternoon.
Maggie, could you describe the patient population you serve and talk about the efforts you're making to keep this vulnerable population safe?
Sure. So we're a federally qualified community health center. So we serve almost 14,000 residents on the North Shore and Cape Ann, probably about 2,500 folks in Cape Ann. And what we do is we do comprehensive primary care, which includes medical services, your family doctor or nurse practitioner or physician's assistants. We do dental care, both ongoing dental care and emergency dental care. And we also do substance abuse treatment and behavioral health. So we have therapists and psychiatrists who are available to help folks. Because via our mission and mandate, we see anybody who walks through our doors, regardless of insurance, whatever insurance or if they have insurance. So we really take care of folks who are pretty vulnerable. We have a lot of patients who are homeless and a lot of people who are struggling with substance use disorders. We take care of some highly vulnerable residents on the North Shore and in Cape Ann, and we are happy to do it. In terms of our response to the pandemic, we've been watching. We sort of were watching what was going on in China starting in January, and we're starting to wring our hands a little bit because in this global environment that we live in, we knew that it was just a matter of time before we would start to see some cases in the States. So really in February, we started planning efforts. We started to order more personal protective equipment. We just started to get ready. And what happened on March 13th was really a game changer for us. That's when Secretary Sutters announced that Mass Health would pay for telephonic visits, not just video visits, but visits delivered on the telephone, and that they would reimburse us at the same rate as an in-office visit. Because at that point we were already struggling because we wanted to figure out a way to keep our staff and patients maximally safe. And the best way to do that was to have as many people at home as possible. So our leadership team and our medical directors really sprang into action over the course of a weekend. And by Monday, we had 3 of our medical providers who were starting to do telephonic visits. The responses from our patients were just incredible. They were so happy to not have to leave their house to come in for visits. And our medical providers also expressed a lot of satisfaction. They were able to, they felt like they were able to have much longer conversations with their patients in this environment than if they were doing an in-person visit. And then by Wednesday of that week, we were doing 100% of our visits, 100% of our behavioral health visits, including psychiatry, were telephonic, and about 85% of our visits were being done on the medical side. We continued to do dental care for that week and into the next week, but we just felt like, and the recommendations coming from the American Dental Association and the Massachusetts dental folks were really that dental care is not safe. We were restricting ourselves to only emergency dental visits, but we just felt like it wasn't safe for the care. So we have arranged right now for any dental emergencies to be, if one of our patients calls us and has a dental emergency, we kind of have a direct line to the dental director at Lynn Community Health Center, who are still doing emergency dental visits. So we're doing it that way. And right now, our offices in Gloucester and Peabody are closed. People are if they need to be seen, they can call us and we'll do a telephonic visit, or if they can get down to Salem Family Health, for an in-person visit, we'll see them there. The other thing that we're going to start doing once our ring starts working up in Gloucester, we have a ring doorbell button that will ring right to our nurses. And they'll speak with the patient, and if the patient needs to be seen, can't get down to Salem, then one of our medical providers will come and open up Gloucester Family Health, so the patients can be seen there. So just trying to be maximally flexible and responsive to our patients during this really critical time, because the most important thing is to keep people out of the hospitals unless they absolutely have to be there. We really want people home. Even if you're sick with COVID, we will help you to manage your symptoms at home. We're doing telephonic visits. We're checking in with our patients who are sick almost daily to help them manage their symptoms, and also to keep an eye on them just in case they start to feel much worse. Then it might be time to go to the hospital, but don't start there. Start at home where you're safer, and you can, we can help you to manage your symptoms there. That's really the goal. Our hospitals need to be reserved for only those folks who are very sick and absolutely have to be there. Everyone else should be staying at home where it's much safer to be.
Was there any problem getting the message out to your clients how important it was to stay home? Because one of the big issues is if you are unsure of your resources and you're sick, you may not go to the doctor, you may not reach out, you may just try to deal with it. So was that an issue?
So again, we started a little bit early on in this process. We started putting out messages to our patients. We sent out via text. We put it up on the website. We have it on we work with a call center that's actually based, I think, in Florida. And we had messages on the call center. So every time they called, they heard a message, please stay home and call us if you're not feeling well, but don't come in. And we also sent out postcards to all of our patients, all 14,000 of our patients. We did phone calls to all 14,000 of our patients. So we really did a huge push to let people know what we're doing, why we're doing it, how it's going to affect them, and phone numbers everywhere. We also, our pharmacy in Salem, we have an on-site pharmacy with a partnership with CVS. They started doing free home delivery. I think that was last week or the week before that. So really trying to minimize as much as we can people having to leave their house to come to our site in Salem really for anything. And by lots of measures, it's been pretty effective. Last week, I think we saw one person face-to-face who really needed to be seen. He didn't have a telephone, had no way of knowing, no way to get a hold of us. So we were able to see him, and we needed to see him. And I think this last week, we also only saw one patient. So I think the messages that we're sending out are pretty effective.
Yeah, but we had talked, you and I, earlier about reaching out to the homeless population and
yes.
There. So you want to talk about that a little bit?
Sure. So we worked in a coalition with folks down here in Salem and Lynn and Peabody to develop a quarantine site for folks who are in homeless shelters who may have been exposed to somebody who tested positive for COVID, to a place for them to be away from the other residents and wait to see if they get sick, they're sent to a different place. As the state has set up isolation units across the state for folks who are homeless to keep them comfortable and safe. The work that we're going to do hopefully this week is we're going to start testing the folks at Action, both the residents and the staff, to make sure that they haven't been infected. The Action, thankfully, Action acted very early and smartly and moved folks out of their congregate space into the Y, where there's a lot more separation, which is terrific, actually very forward thinking of them, and it was great for them to have a space to be able to do that. So, you know, they're a little bit at lower risk, but they're still at higher risk, and we really want to be able to identify folks early and then get them, you know, the care and the treatment that they need if they test positive. So we'll be doing that starting this week.
Okay. Is this part of state mandated testing wave? Because I know Governor Baker has talked much more recently about getting a lot of testing done. Or is this an initiative within North Shore Community Health?
This is a North Shore Community Health initiative that's really, it's driven by the need to test in the community, and particularly to test those folks who are highly vulnerable and also who might have kind of fallen off of the radar of other places in the push to have people tested in hospitals or parking lots in Lowell. There, I think we need to be sure that we're remembering and testing folks who are very vulnerable, and that's, since those are our, you know, that's our patient population, that's who we normally think of almost immediately. So it's part of that. It's part of the, you know, we want to be maximally responsive and responsible and to what the governor's trying to do and pushing out the need to get more folks tested. So we're stepping in and stepping up and saying, we're going to do this work because it's really important work, and happy to do it.
Yeah, and it's important for the larger community too. Just the more testing we can done, the more identifying where this virus lives. Yeah,
exactly. And really, the only way we're going to get out of this is if we have broad-based community testing that everyone has access to, because we can't stop the social isolation until we are able to very quickly identify and isolate those folks who are walking around with the virus. Right, the minute we all come out of shelter in place, and if we don't have access, then we're just going to be right back here. So we just need to be so careful and take a very measured approach. I know it's really exhausting and anxietal for a lot of us to be sheltered in place and not in our normal routines, but this is the safest course to keep the most of us not infected, really. So, and we just need to keep our eyes on the prize and making sure that we're doing everything we can to if we're not sick, to stay that way, and both individually, but also as communities. Right.
Is there anything else you want to ask of our community? Do you need volunteers? Are you looking for donations? What can we do to support you?
You know, just we are, you know, we're always we're open for business, and in this you know, in this environment where there's so many people who are newly unemployed, which is so unfortunate. I haven't seen the latest numbers today, but as of last week, there were 16 million people who are unemployed, and Massachusetts hasn't remained unaffected. So I want to just make sure people understand that we are always open and able to see patients, and happy to see more patients, regardless of we will help you to find an insurance program to get on if you're newly unemployed, and we will help you to get on Mass Health if you're eligible for that, or we'll find another way to get you insurance, and we will certainly provide the care to you. This is what we do, and we are happy to do it, and happy to be working with terrific partners in the Gloucester and Cape Ann community. You know, that you have a wonderful Department of Public Health. You have great providers and Action, and you know, Open Door. It's just a wonderful community, a very caring community, and we are really pleased to be a part of that community.
Great. Do you want to leave us with a phone number?
It's 978-744-8388. And please give us a call. And even if you aren't our patient now, we are happy to see you. We'll have a video function for visits probably by the end of this week, but we are always happy to talk to you on the phone. And we expanded our hours, so we're 8 to 8, Monday through Friday, and we're seeing people from 9 to 4 on Saturdays and Sundays.
Wonderful. Thank you so much, Maggie, for everything you're doing.
Thank you.
And
appreciate it.
Thanks again. Bye.